I love the DualWave pump. I've been using it for over 5 years now, and it's really become an integral part of my OR setup. The thing I like the most about the DualWave pump is its consistency. The setup is easy, I can personalize my own settings, and regardless of where I'm operating, whether it's in the hospital setting or a surgical center, I know I'm gonna get a nice, reproducible visual field. I think there are a lot of benefits that my patients see as a result of the DualWave pump. First and foremost is I get a nice, consistent visual field. I get very little pressure fluctuations throughout my case, so I'm able to run my pump at a nice low setting, which leads to less soft tissue extravasation. A lot of times I'm able to use little or no tourniquet at all, and I think that improves post-operative pain and overall function. Personally, I like to use the outflow on all my cases. I think that really allows me to optimize all the features of the pump. I can keep my suction toggle wide open, and that minimizes the bleeding as well as the fluid fluctuations that I often saw before. It allows me to use different features like the lavage feature, where I get just a short time cycle of increased pressure, and also the rinse feature, which is just an increase in flow and allows me to clear debris and maintain a nice clear field. I think one of the additional features with having the inflow-outflow system on the DualWave pump is it allows me to minimize the extra things that I used to do to try to minimize bleeding. I no longer use epinephrine in my bags. I use normal room temperature saline during my cases and no longer have to use refrigerated or extra cold saline, which can sometimes cramp your hands. I think the benefits definitely outweigh the cost when it comes to outflow tubing. We've been able to use much less fluid during our cases when we're using outflow. We are also able to improve our overall efficiency, which cuts our OR time down, and I think that leads to overall improved savings for both the healthcare system as well as to society. I prefer a 3-portal setup in the knee. I like to use an inflow cannula in the suprapatellar pouch, and I attach my outflow cannula to the scope itself. I think it gives me a nice clear field. It's constantly rinsing and cycling fluid throughout the knee. It's clearing debris out of my face and out of the visual field so that I'm able to see what I'm working on, whether it's a meniscus or an ACL, even if I don't have an instrument in the knee like a shaver. Heads-up display is very helpful. It allows me to monitor all my instruments, whether it's RF or my shaver settings, my flow rates, all without taking my eyes off the video screen. I think the remote control has many benefits. Most importantly, it's sterile, it's on the field, it's in the palm of our hands, and allows us to control all the features on the DualWave pump right here. I prefer using the rinse or lavage feature. I can increase my pressures if I need to. All these things are readily available, and we're not having to rely on a circulating nurse or someone who's outside the sterile field to operate the pump. The DualWave pump helps us with more complicated cases. We're asking our surgeons to do more and more with arthroscopic techniques, things like superior capsular reconstructions, massive rotator cuff repairs, multi-ligamentous knee reconstructions are long and complicated cases. For those cases, it's really important to have a good, clear visual field and minimize the soft tissue swelling in order to maximize our efficiency. So I think as we increase the complexity of our cases, having the tools like the DualWave pump that are going to allow us to see what we're doing and spend the time and focus our time and energy on the case at hand is going to be very important.